Radomski, Chapter 12, Occupation as Therapy. This diagram shows how occupations are central to an individual's identity and competence and offer meaning and value. Selection. Selecting an occupation as end. Occupation as end are activities that comprise the patient's perceived life roles. Steps to selecting occupation as end include the patient and therapist identify key activities that would enable the patient to engage in his or her desired roles within a particular context. Next, through activity analysis, the therapist matches the patient's capabilities to the demand level of each activity. Selecting an occupation as mean. The best activity for remediation is one that intrinsically demands that exact response that needs improvement and can be graded up or down. These occupations should generally have the necessary characteristics to evoke the desired response, allow gradation, be within the patient's capabilities, be meaningful to the person, and be as repetitive as required to evoke therapeutic benefit. Gradation. Selecting and grading therapeutic occupations as means. The book includes examples for the following: to retrain sensory awareness, to decrease hypersensitivity, to relearn skilled voluntary movement, to increase coordination, to increase range of motion, to increase strength and endurance, to decrease edema, improve perceptual impairments, and to increase attention, memory, and problem-solving skills. Analysis. Activity analysis is a fundamental skill of occupational therapists. Through activity analysis, one gains an appreciation of the activity's components and characteristics. Occupational therapists analyze an activity because they want to know whether the patient, given certain abilities, can be expected to do the activity, and whether the activity can challenge latent abilities or capacities and therefore improve them. Steps to activity-focused analysis. 1. Describe the activity. 2. Describe the task demands. 3. Identify the primary therapeutic aspects. 4. Modify the activity demands to calibrate difficulty level. Adaptation. Activity adaptation is the process of modifying an activity of daily living, craft, game, sport, or other occupation to enable performance or accomplish a therapeutic goal. Reasons to adapt an activity. 1. Modify the activity to make it therapeutic when ordinarily it would not be so. 2. To grade the exercise offered by the activity along therapeutic continua to accomplish goals. 3. To enable a person with physical impairments to do an activity he or she would be unable to do otherwise. 4. To prevent trauma injury, especially working activities that are engaged in for long periods of time. Parameters used to adapt activities. Required body functions, required actions and performance skills, objects and their properties, and sequence and timing can all be adapted.
Okay, so now we're going to move on to Radomski 13, which is focused on learning. So, learning is a primary therapeutic mechanism that underlies many OT interventions. So some tips that an OT can use is that they need to be prepared and ensure that they have the materials and the props and equipment needed for the learner. They can also use strategies to maximize learning and methods that support the person's or the client's learning styles. Finally, you have to determine whether learning has taken place. And to do this, you want to ensure that the patient's performance indicates the learning to which the specific skill has been learned. And and then you want to look for whether or not cues and practice is necessary. Because if this happens, then that may indicate that learning did not occur. And within the Radomski chapter, they made mention of the human processing model of learning. And learning is basically linked to memory. So it basically dictates whether um, a particular encoding and retrieval of information, and it is a transfer of information from short-term memory to long-term memory. So that's what learning is specifically about. There are control processes that are involved for learning, such as rehearsal, coding, and imaging, and these occur to move information from the short-term memory into long-term memory, and information is better retained when the person is deeply involved or when deep processing has occurred. So there are two types of functioning, which is control versus autonomic processing. So control process functioning is more effortful, and it's used in novelty situations when the person is trying to learn a new task. Whereas there is automatic functioning, and this occurs when a specific stimuli or trigger activates a particular learning sequence, and this occurs with enough repetition to ensure that the person has learned a particular skill. Implications of the information processing memory model. So here, the occupational therapist assesses attention and memory before teaching of skills and or strategies. And the OT must be aware of any pain, fatigue, and noise to allow for limited capacity cognition for learning of a new skill. Clinical considerations in teaching clients. You want to be aware of the characteristics of the learner so you can know what modes of input to use, what approaches to apply, as well as what tasks remain meaningful or are most likely to facilitate learning for the patient, as well as how learning can be transferred to other environments and circumstances and situations. You also want to anticipate the length of the treatment session and the stages of learning. So for stages of learning, is it cognitive? Whereas the patient tries to understand what is required of the task that they're going to perform, or is it associative where the patient is able to generally perform the task, but eventually they need to refine what it is that they're learning? Or is it autonomous, where the new skill becomes easily automatic or habitual? For desired learning outcomes, there is task-specific skills versus general strategy related to expectations for transfer and generalization. So for task-specific, the activity is focused mainly or more specifically on a specific activity. So for dressing, if the person is only using one hand at the bedside, and then for strategies and generalization of learning, this entails learning rules or principles that can be easily applied. So, for example, they're addressing the weaker side first. For fundamentals of the teaching learning process, you can ensure to focus on the therapeutic use of the context, therapeutic use of feedback, as well as therapeutic use of practice. For making personal change, there are a variety of approaches that you can take. Something that's very popular is the behavior change model, where the therapist targets a specific behavior, and so the therapist is looking at the five stages of change, which are the pre-contemplation, moving into contemplation, determination, action, and then maintenance, where the person is basically able to maintain the change that they have gone through. And then there is motivational interviewing, which is a method designed to help clients make behavior changes. Um, and within this type of approach, the therapist must be aware of their communication styles, whether they're using guiding or following or directive to help the person make that behavioral change. The OT as a teacher, the OT must try to assess learning needs and readiness. They may make sure to set client specific goals, create learning opportunities throughout the intervention, and finally evaluate achievement of learning goals.
Okay, so now moving on to Pedretti, Chapter 7, Teaching Activities in Occupational Therapy. So there's 3 phases of learning. You have the acquisition phase, then retention, and then you finish off with generalization and pretty much transfer of learning, which is when the learner can spontaneously perform the task in a different environment. So one way for learning capacities, one thing to do is there's a thing called dynamic assessment, which is an approach used to determine a person's capacity to benefit from instruction. It's an interactive process that uses feedback, encouragement, and guidance to achieve a person's optimal performance, and it involves a test-retest format, and it allows the therapist to observe learning and change. So there's 2 types of learning, procedural and declarative. Procedural occurs for tasks that are typically performed automatically and developed through repeated practice in varying environments, whereas declarative learning creates knowledge that can be cognitively recalled, often facilitated if the person can verbalize the steps of the task while doing it. Through repetition of declarative learning, it can become procedurally learned, and mental rehearsal is a good way for enhancing declarative learning. So the principles of teaching and learning in occupational therapy, there are 6 of them. First, you want to identify a meaningful occupation, activity, or task, choose a compatible instructional mode, structure the learning environment, provide reinforcement and grading of the activities, structure feedback and practice schedules, and help the client develop self-awareness and self-monitoring skills. So to wrap up this chapter, we talk about therapeutic use of self. So there are 7 OT core values. Those are altruism, equality, freedom, justice, dignity, truth, and prudence. And we have 6 OT ethical values or ethical principles that you should review for the exam. Those are beneficence, non-maleficence, autonomy, justice, veracity, and fidelity.